everyone, welcome to another video. So in today's video we'll be looking at a different topic. We'll be looking at yellow fever. So what exactly is yellow fever? Yellow fever is a serious viral illness that is caused by the yellow fever virus, hence why it's named yellow fever. So it's caused by this yellow fever virus, which is spread by a particular mosquito. So it's spread by infected mosquitoes, and the name of this mosquito that spreads this yellow fever is known as Aedes aegypti mosquito. So this mosquito is also the same mosquito that spreads Zika virus. And basically this condition is known as yellow fever because it has this distinctive symptoms. So it causes yellowing of the skin and eyes, which is known as jaundice. So this yellowing of the skin and eyes is usually seen in severe cases, and it can also cause anything from a mild fever to like life-threatening bleeding and even organ failure. So let's look at the background. So yellow fever is actually a mosquito-borne disease, and it is not particularly spread directly from person to person. So you can't get it from like contact with somebody that has yellow fever. So how this virus is transmitted is through the bite of an infected mosquito, mainly the Aedes aegypti mosquito. So let's talk more about this Aedes aegypti mosquito. So this mosquito, it is small, it is dark colored, and it has white stripes on the legs. So it particularly feeds during the daytime, especially early in the morning and late in the afternoon. So that is the time that this mosquito is very active. So it usually breeds in like clean, stagnant water near people's homes, all those kind of water you see in the clean stagnant water. So if you not basically gutter, like the water you see in gutter, the water is usually clean, and the water is all those ones that they put in like buckets and they just leave it open, or the one they put in water tanks or like flower pots, for example. So all those kind of water is where this mosquito breeds. So this particular mosquito, it prefers biting humans than animals. So it does not actually bite animals, and it usually lives inside or around houses, making it very dangerous for humans. So once this mosquito bites someone who has yellow fever, the virus develops inside the mosquito for about 9 to 12 days, and after this period the mosquito can transmit the virus to healthy people. So the mosquito remains infectious for basically the rest of his life, and it can spread the disease to a lot of people. So that's why when there's a pandemic or epidemic of this yellow fever, is often very serious, because once this mosquito is infected, it can spread to a lot of people. And basically there are three types of transmission cycles. There's the number one, there's the jungle cycle between the mosquito and monkeys in the forest. Then there's the intermediate cycle in which is in rural villages near forests, which is common in Africa. Then there's the urban cycle, from person to person transmission through the Aedes aegypti mosquito in like big cities and all that. So the urban cycle is especially dangerous because it can lead to large outbreaks if people are not vaccinated. So the best way to prevent getting this yellow fever is to get the yellow fever vaccine. Looking at the anatomy and physiology, yellow fever mainly affects the liver. That is why one of the main symptoms is jaundice. So it mainly affects the liver, but it can also damage other organs like the kidney, the heart, the bone marrow, and the spleen. So this is how it works. So the liver is the main target for this yellow fever virus, and it is responsible, and the liver is responsible for filtering and detoxifying the blood. It's responsible for producing bile, storing glycogen, and making clotting factors. So this is basically what the liver does in our body. So when the liver is affected by this yellow fever virus, the liver cells, which are called the hepatocytes, they get damaged, and once they get damaged, it leads to conditions like jaundice, that is the yellowing of the skin and the eyes caused by buildup of the bilirubin. Then it also causes bleeding problems due to low production of clotting proteins. So the it can also cause liver failure too in severe cases. So all the symptoms we see is because the liver cannot perform the normal function it has been performing. So that is why these symptoms will develop. So the virus actually first infects immune cells such as the macrophages and dendritic cells. So these cells, they carry the virus to the lymph nodes. From there, the virus will enter the bloodstream and cause what is known as viremia. So viremia is whereby there is widespread presence of virus in the blood. So the kidneys may also be affected, and it will reduce the ability of the kidneys to filter waste, and this can cause acute kidney injury, especially in the toxic phase. So the bone marrow, where the blood cells are produced, it can become suppressed, leading to low white blood cells and platelet counts, which increases the risk of infection and bleeding. And then when it comes to the heart and the blood vessels, they can also be affected as the disease progresses, leading to low blood pressure, shock, and organ failure if not treated quickly. So from all these things, we can see that this yellow fever is very serious. It is a very serious condition. So it's better for us to take proper preventive measures against this yellow fever virus, because currently there's no cure. There's actually no cure. We'll get to that aspect of the video, but currently there's no cure for yellow fever. So for the pathophysiology, I think I've already explained. The virus enters the body through a mosquito bite. It first multiplies in the immune cells, then it spreads through the bloodstream, causing viremia, and it targets the liver, causing inflammation and damage. So as the liver dies, the bilirubin builds up in the body, causing jaundice. Then reduced liver function leads to skin problems, clotting failure, and toxin buildup. So in the toxic phase of yellow fever, multiple organs can fail, especially the liver and the kidneys. So what exactly causes yellow fever? I've already said it. It's caused by the particular mosquito, Aedes aegypti mosquito, and it's caused by the yellow fever virus that is transmitted by this mosquito. And it is usually not spread directly from person to person. Like if I have yellow fever now and somebody touches me, it cannot, like, the person cannot get yellow fever, even though I pray not to have yellow fever, but this is just an example. So for the differential diagnosis, so some yellow fever may look like other conditions, like it can have similar symptoms to malaria, dengue fever, viral hepatitis, typhoid fever, leptospirosis. So usually laboratory tests are actually needed to tell them apart, because they have similar symptoms that can actually look similar. So for the signs and symptoms of yellow fever, there are 3 phases. So there is the initial phase or the acute phase, and this phase comes with sudden high fever, headache, muscle pain, especially in the back, nausea, vomiting, and loss of appetite. Then usually most people recover after this phase. So after the initial phase, that's the acute phase, there's the remission phase, whereby symptoms may go away for a while, and some patients fully recover after this stage. So fully recover at this stage. Then there's the toxic phase, which happens in about 15 to 25% of cases. So here the fever returns, there's jaundice, yellowing of the skin and the eyes, there's bleeding from the gums, the nose, vomiting, and there's stooling. Then there's blood that accompanies the vomit, often called black vomit. Then there's kidney and liver failure. Like I said, there will be in the toxic phase there will be organ failure, organ damage, and there's shock and sometimes even death in severe cases. So how exactly is yellow fever diagnosed? So yellow fever is usually diagnosed based on the symptoms and recent travel or exposure to like mosquito prone areas. So the doctor will ask the patient certain questions like, where have you been the last recent days, or all those kind of things. So the is based on symptoms and based on like the if the person has been to like a mosquito prone area. So blood tests are also done, like blood tests are done which can detect virus or the antibodies in the patient's blood. And then we also have liver function tests such as alanine aminotransferase, aspartate aminotransferase, and bilirubin. So we check for all these things. So for the treatment, currently there is no cure for yellow fever. Treatment is usually supportive to help the body recover, and supportive treatment usually includes giving plenty fluids either by mouth or intravenously, then also giving paracetamol, that is acetaminophen, for like the fever and the pain. Then we should also avoid giving aspirin or ibuprofen because they can cause increase in bleeding risk, and bleeding is one of the symptoms we see in severe cases in this yellow fever. Then providing oxygen therapy or blood transfusions if necessary, and hospitalization in severe cases for close monitoring. So it's supportive care we usually give in cases of this yellow fever. So for the prevention and the management, like I mentioned before, vaccination is the best prevention, and a single dose vaccine gives like a lifelong protection against this yellow fever, and it's usually given at 9 months of the age. Like babies that are 9 months in Nigeria is given to babies that are 9 months, and is usually required for travelers going to high risk countries or coming from high risk countries, and usually is available for free at government hospitals and government clinics. And there are some countries too that besides Nigeria, there are some countries that they have this mandatory requirement that you have to get a yellow fever vaccine before you come to their country, like some countries in Europe. So you actually have to get that yellow fever vaccination card before they can give you access into that particular region of the world. So for mosquito control against this mosquito that transmits this yellow fever virus, so that's another preventive control. So we can use insect repellents, and we can try wearing long sleeves and long trousers, even though it's not easy, it's not easy when you stay in a region that is very hot. So this particular form of mosquito control is not actually very feasible like that. So but if it's possible, try wearing long sleeves or long trousers, and also sleep under insecticide treated mosquito nets, and Also, try to remove stagnant water sources near your homes, like such as stagnant water in containers or tires or pots. So try to remove all this kind of stagnant water. And usually it's better to educate patients about the importance of vaccine, especially before traveling to endemic areas. And it's better to tell them about the kind of symptoms they should watch out for, and tell them to try to go for hospital referral if they have severe symptoms. And also just try to raise enough public health awareness about this yellow fever. And so basically the summary of this condition is that what causes the condition: yellow fever virus, transmitted by the Aedes aegypti mosquito. The main organs that are affected: the liver, the kidneys, the bone marrow, the heart. The symptoms: fever, jaundice, vomiting blood, bleeding, stooling, organ failure. Diagnosis through blood tests and through your travel history too. And then treatment: there's no current treatment, only supportive care, like I mentioned. Prevention: vaccination and mosquito control. And basically every healthcare professional, whether pharmacists, whether doctor, whether nurses, their role is to educate the patient, guide the patient to go for vaccination, and to refer urgent cases in cases that are severe. So that is the breakdown of this condition known as yellow fever. So I'll see you in the next video. Bye.